Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about consumerism. It's hard for some people in the healthcare industry to get comfortable with the word consumer. But it really is more than just semantics. People are patients only when they are actively receiving care. People are consumers while they are receiving care and while they are making decisions about their future care. In healthcare finance, we often interact with people just before and after they are in the full patient mode. But if we only think of them as patients during this time, we potentially ignore a more holistic view of their health and their lives. And yes, this can have an impact on their financial relationship with us in the industry. So while using patient may seem more natural, it shortchanges the people we serve. Price transparency is an important part of consumerism, but it goes way beyond that. Think about consumerism from a consumer products perspective. Having a price tag on an item is expected. It's just the start. But most of us don't even do that well yet. There are also issues like how we describe things, how we enable consumers to access our services, or what happens when things don't go well. When we buy something in the general retail environment, we expect there will be a refund policy. Nothing extraordinary about that. But when Geisinger introduced a refund policy this year, it was front page news. That's an indication of how far we have to go in adopting a consumerism mindset. Third-party payment makes healthcare different, but not entirely unique. Compare healthcare to higher education, for example. Colleges typically make need-based financial aid available to those who qualify. Look at any college or university website. My guess is that it won't take you very long to find financial aid information, including application forms. And most people won't feel any stigma for asking colleges about financial aid or applying for it. Plus, they have people to guide you through the process. How does that experience compare to researching and applying for aid under a hospital's financial assistance program? In most cases, the hospital financial aid experience is not close to being on par with the college financial aid experience. We just don't seem to be able to communicate complex processes and terminology in plain English. And to say it's complicated is just a lousy excuse. Think big. Look at the whole financial experience, not just the transaction. If you define the challenge as getting the bill paid or getting the insurance claim adjudicated more efficiently, you won't see it from the consumer's perspective, and you'll miss the big picture. If you define the challenge as what you can do to make the consumer's financial experience the best it can be, then you'll be on the right track. From that vantage point, you can deconstruct and reinvent all the pieces that go into creating a good financial experience. For example, when is the last time you've really looked, at your consumer-facing communication? Your bills, your statements, your EOBs. Are they written in everyday language? Better yet, get input directly from consumers. In any market, there's no substitute for input and feedback from your customers. They will tell you if the language that you're using makes sense to them. In closing, the best place to start is with the fundamentals, not with the bells and whistles. And it starts with an honest look at how we operate today. Our best practices for patient financial communication provide those fundamentals. More than 150 healthcare organizations have now adopted HFMA's best practices, including many of the leading healthcare systems in the country. Each organization that joins the best practices community makes our nation's healthcare system a little bit stronger. I hope your organization will be next. Thanks for watching. I'll see you next month.